Wow. Okay. So, I mean, that's a fascinating story. And let's talk about your health insurance situation here, right? This is an economics class, so we're going to get to the nitty gritty, maybe some of the more boring details that you probably don't get asked about as much. What was your health insurance status before you got treated, and what did you discover about insurance as you were recovering from being shot?
Yeah, no, so I had Kaiser.
Hmm.
I had Kaiser. Washington State has a good amount of social safety nets,
Hmm.
just to like paid leave and stuff like that. So somehow I had called my actually no, my work called me in actually while I was in the hospital bed. They're like, "Hey, you haven't been picking." I'm like, "I'm dying, dude." Uh, so So that's how they put me on paid leave and whatnot. My insurance was kicked in. Um, and like, yeah, halfway through it, like this lady came up to me in like a nurse's outfit. So I'm like, are you gonna take care of me and help me and stuff? She's like, takes the mask off. Oh no, I'm here to talk about your bill. I'm like, that's exactly what I wanted to talk about. Like, wear like a suit or something to where I know you're screwing me over. But so yeah, like instead of just like, oh, I thought you were gonna give me my medicines, whatever.
Hmm.
Um,
You're not in the right uniform. That's
yeah,
not the I'm screwing you uniform. That's the I'm
exactly.
helping you uniform.
But yeah. So and yeah, she was like, so Kaiser and Harborview, like the week I got there, were like not continuing the contract or something. And she was like, for all intents and purposes, you're like out of network. I'm like, great. That's amazing.
So your insurance doesn't cover this.
Well, no, it does cover it was gonna cover things regardless. Just
Hmm.
I mean, in-network coverage is just always going to be more than out-network coverage. I believe Biden passed the bill after I got shot to where it's like I think it applies directly to my scenarios. So we're like, if you're out of network, you get sent to an out of network hospital. You can't be billed as if it's out of network because you can't always choose the hospital you get sent
Hmm.
to, something like that. So that would have helped with me in that situation. Um, but yeah, so that was annoying. And then, I was looking at the bill. I was looking at the bill while I was in my hospital bed. I was like, oh my God, you guys gave me this. And like, I just saw it all tallying up. I was like, oh, you guys gave me fentanyl? Apparently they gave me fentanyl to, I don't know. Um, so
So just to clarify the insurance situation, you had coverage, but it was out of network, so it was not very good coverage.
yeah, so the out of pocket was going to be so much higher.
Hmm.
I didn't have this supplementary insurance, which is what we're going to kind of get into. Uh,
Yeah. And
so
what just to set the stage, what kind of bills are we talking about? What were you charged? And then if you know what you were going to have to pay out of pocket, or remember that,
I
just to put some
cannot
numbers.
remember everything. Here's the thing: I don't even think my in-network coverage. It was still going to cost a lot out of pocket because
Hmm.
I sent you the bill. My total bill was
Yeah.
$1 million. Okay,
Yeah, it was over 500,000. It was insane.
yeah. So it was a lot. Surgeries, at least two surgeries, whole bunch of tests and stuff.
Hmm.
And even in network, I think I still would have had to pay like 10,000 out of pocket or something. Um, but I think it was probably I can't quote myself on this, but I
Hmm.
know it was more. It was like 30,000 or something.
Yeah.
Okay, still pretty good. And I'll say this: like Kaiser again covered a good amount. It's good insurance. Kaiser was good.
Hmm.
I had good insurance. So, but I didn't have to worry really about any of that because in America you have crime victims compensation, where I did a little bit of research on this to where it got enacted under Ronald Reagan. There's a fund that I believe Department of Justice or the Office of Victims of Crime cover from the federal government, and it covers Washington D.C. and all the states. to where each state, each district will get some federal funding to account for medical costs of and mental health costs, lost wages, funeral expenses for victims of crime. Now,
Hmm.
it's vague. It depends on each state kind of decides their own limits and whatnot.
Hmm.
So it's not equal. Um, each state has their own qualifications. Luckily, Washington State was very um, uh, they cover a lot. So
Hmm.
um, I had to work with the Department of Labor and Industries for years, actually, to like make sure none of this was coming back to me.
Hmm.
Uh, and yeah, basically how the crime victims insurance works is just whatever your insurance doesn't pay, they will work with the hospital and pay it off. So
Hmm.
that's what they did. I have the whole email thread, and it was that was almost more annoying than being in the hospital for a month. It was like because I
Hmm.
had to deal with that for a few years, like, and I guess I wasn't even supposed to. So that's something your students might, if God forbid something like this were to happen, it's just like you're not supposed to be the mediator between your hospital and the Office of Crime Victims. They're supposed to be able to talk on your behalf.
Hmm.
I was like, I had to like mediate between them. Like, well, what they say? I'm like, I don't know. You're supposed to be talking to them. I gave you the case. It was crazy. But then again, maybe this was a really weird case. I could tell from how they
Hmm.
talking. Like, this is like a really lot of money. So, uh,
Yeah. Oh, yeah. Tons of money.
yeah. So, um, yeah, that's an insurance that a lot of people don't know what they have. But here's the thing, I believe from what I looked at, Washington State has it to where they'll at the end of the day they'll do a case by case basis, I guess, for cases like mine that are just so high. But I'm not
Hmm.
convinced that the Labor and Industries Department of Washington State paid for all of it. I didn't pay
Hmm.
anything out of pocket. Uh,
Hmm.
I looked at my Kaiser Insurance before it was called my Kaiser Insurance billing records before this. I don't even know how much if they even paid that much. I'm
Hmm.
thinking, especially based off the lecture I was reading, listening to you, that I think the hospital covered a lot of it. Uh,
Yeah, they probably did.
yeah, I don't know the percentage. I don't know how that all worked out. I just know I didn't have to pay anything. So free healthcare, baby. And I also got free dental work because I had a wisdom tooth that had to get taken out.
Hmm.
Also, during one of my surgeries, they just had to like take it out to fix me up.
Hmm.
Got free dental work also. So that's also a loophole.
So if you can't pay for dental work, you can get shot in the face, and then prime victim insurance will kick in. And if you're very lucky, um,
Yeah, no,
I,
I got a whole bunch of benefits. I was like, I got the paid leave. My apartment complex was like, you don't have to pay rent for the rest of your lease, which was like 6 months. I'm like, okay. And
wow.
then it was during because it was during COVID, so they had a whole bunch of like COVID stuff to help renters and stuff. And
Hmm.
this had nothing to do with COVID, but the county was just like, you can have it anyway. We're just giving out money at this point. And then
Nice.
then I got my paid leave. So like I netted like a bunch of money, like 15,000 bucks. I was like, dude, shoot me again. Let's do this. I'll do it. Like I have another face. So no, no, don't do that. But
Okay. Oh, now that I was going to, but now that you've made it clear you were joking, I was on Amazon. I was ordering a gun. I'll cancel the order.
yeah.
Uh,
But yeah, that's crime victims insurance. I love the program. I did actually a speech in undergrad proposing to like expand it and make it more universal. I think it's a good catastrophic coverage
mhm.
program. And but yeah, I'm also convinced Harborview definitely had to pay a bit too.
Yeah, yeah, and so I mean there's a lot going on with the insurance system, and your story really exemplifies many different aspects, right? So just I'm gonna go economist for a second, right? So first, right there was in network out of network, right, where insurance companies negotiate rates separately with different hospitals. And so, because Kaiser effectively had said we're not going to have special negotiated rates with Harborview anymore, um, you on paper would have been charged much more because your insurance company couldn't handle that. And as we covered in the lecture on the hospital industry, you didn't necessarily have a lot of choice over where you were sent, right? You showed up and then discovered you were in Harborview. You had no idea that you would end up in Harborview. But that's where they took you. Um,
I mean, yeah, and that's one of the few hospitals in the state equipped to actually deal with that type of injury also.
mhm.
Like,
Exactly, exactly. And so, right, this is another way hospitals compete is on quality, where my understanding is Harborview has phenomenal quality. It's one of the best hospitals in the country.
yeah, definitely.
Yeah.
Um, but yeah, what was I gonna say? Yeah, so yeah, I guess the TLDR, what I can say is there's a lot of bureaucracy with it. Um,
Hmm.
um, which goes with I guess goes with the territory with all insurance. But I'm glad we have it. One
Hmm.
thing that I've always thought about regarding this, opining a little bit, but it's just like, what if I had a similar injury,
Hmm.
material, physical damage to me, and I need basically the same surgeries and whatnot, but I wasn't a victim of a crime.
Hmm.
It's like, oh, okay. I might have been stuck with a lot of
Yeah.
and I at that time I was making maybe 40K a year, so it was like on the definitely on
Hmm.
the lower end. So like maybe Harbor in that hypothetical Harborview would implicit insurance would kick in for someone like me, but
Hmm.
it also is kind of a little crazy that you have to rely off of that. So
Yeah. And that it's not codified, right? You didn't know you had any of the special coverage, right? And very few people know, at least in my experience, about implicit insurance that you often don't pay the full price of your medical bills, even if you're not insured.
yeah, yeah, and it's so yeah, I guess that's really my story. That's really all I have to say with it. Unless you have any, yeah, if you have any questions.
No, you did a fantastic job explaining the story. If you don't mind, I'd like to end the interview by translating the story into economic speak and tying it to specific concepts from the course. Feel free to correct me if I get anything wrong. Um, the first thing is that and now students, I'm talking to you more so than Ian. Ian suffered a catastrophic industry. Sorry, not a catastrophic industry, a catastrophic injury, right? So he out of nowhere had a massive medical shock that cost that was incredibly damaging and on paper would have cost him over $500,000. Um, when he was taken to a hospital, he didn't have any control over what hospital he was taken to, right? He wasn't super. He was aware for some of it, but they gave him a bunch of drugs and they knocked him out. So he didn't control what hospital he was sent to. So the hospitals couldn't, in some ways, they weren't competing for him in the sense as a patient, right? They were competing for people to send him. They were competing for the ambulance company to send Ian to the hospital rather than saying, "Hey, Ian, come to Harborview." They were saying, "Hey, ambulance companies, send your patients to Harborview," right? So this is a feature of the hospital market where hospitals don't necessarily compete directly for patients. They often compete indirectly for patients by saying, "Hey, medical providers, send your patients to us," and that's what happened to Ian here. Um, and then once he got to the hospital, um, it turns out that it wasn't in network, right? So Kaiser hadn't negotiated special rates with Harborview, and as a result, Ian was on the hook to pay a lot more money than he otherwise would because his insurance, he didn't have full insurance here. He only had partial insurance. Um, but as a result of sort of the crime victims insurance and government programs, as well as the generosity of Harborview, he ended up not having to pay anything out of pocket because a combination of the government stepped in and paid some of the bills. Um, the and Harborview also paid some of the bills as well. Likely, we don't know exactly what happened, but it's likely Harborview ate some of the cost. Um, and this is and part of this is also right. So if you all remember the data from the Lockwood study, even fully insured people, they plus their insurance companies rarely pay the sticker price, the charge master price for various procedures. So even if Ian had full insurance, he'd been in network, and Kaiser had been paying um, the full bill would have been less than the bill on paper was, right? That's one of the reasons the insurance companies negotiate with hospitals is to lower that bill from the sticker price. So a surgery with a $500,000 sticker price, most insurance companies in practice might negotiate that down to 400,000, for instance. Um, but but since Kaiser was out of network, they hadn't done any. My guess is they probably didn't have any special negotiation fees for that. So Kaiser may have been on the hook for all of that, or as much as you plus Kaiser, Ian plus Kaiser may have been on the hook for that entire bill. But due to crime insurance, which is a form of implicit insurance, right? Implicit insurance is partially right. Part of it is hospitals; they eat the cost of the medical treatment. Part of it is the government gives hospitals money for medical treatment, right? So, for instance, even though Medicaid reimburses hospitals for care, hospitals that see a lot of Medicaid patients get additional money from the government because the government knows that hospitals that have a lot of Medicaid patients also have a lot of uninsured people who can't pay their bills. And so, even though Medicaid in many cases is full insurance, and if you get sick, if you have to go to the hospital while you're on Medicaid, Medicaid might cover everything. Um, the federal government gives hospitals that have lots of Medicaid patients additional money, and it's not to care for their Medicaid patients; it's to care for the non-Medicaid patients who still can't pay their bills. Right? They don't have Medicaid, so they're uninsured, but they're still low income and and can't pay their hospital bills. Um, and so, right, Ian, right, like this story illustrates a lot of the quirks of the U.S. system and the hospital system, which is why I wanted to interview Ian for this course. Ian, thank you so much for taking the time. I really appreciate it.
Yeah.
Yeah. Did you have any parting words you want to share with the students before we call it quits?
Yeah, try not to get shot. Don't recommend it. But yeah, no, glad this is a subject I'm very, especially after that ordeal, I've delved into a lot. Like I understand insurance more, and like health insurance is kind of a thing I look into a lot. So yeah.
Yeah. Yeah. Wonderful. Thank you so much.
Yep. All right.
All right. Have a good rest of your evening.
All right.